Hi everyone, I'm Dr. Tay and I've been a student of Dr. Tariq for the past 5 months. I'm a general practice medical doctor interested in truly integrative, gentle and intelligent ways of approaching patient care. As a younger person, I struggled a lot with minor chronic conditions and it left a really big impact on my self-confidence. If I can't heal myself, who am I to help other people around me? So I've been looking for answers everywhere and someone who can really explain to me what's going on in my symptoms. What do my symptoms really mean? So I'm a student of the art as well as the science of medicine. Over the past 12 years, I've learned that there's really nothing we can't solve if we use our intelligence and applied science. So in the past few months, I felt my interest in medicine rekindled, my trust in my body renewed as I worked closely with Dr. Tariq Jagmag to solve these puzzles and open the doors that were once closed to me. So we're going to get into the topic of this webinar series, which is long COVID. But first, Dr. Tariq, what do you do exactly?
That's a good question, Dr. Tay. What exactly do I do? The best way to answer this in short is to say that I'm trying to correlate the patient's symptoms to the pathways which are causing those symptoms to them. And how I'm doing this is, for example, when a patient tells me that they are having a headache, okay, when you have a headache, the first thing you want to do is to pop in some painkiller. You want to take in some paracetamol or you want to take in some combiflam. What I'm trying to do is I'm trying to tell the doctor or the patient that look how interesting your headache is. Is your headache getting worse because of acidity? Is your headache getting worse when you're wrapping something on your head tightly? Is it getting worse due to sun exposure? If it is getting worse, because of sun exposure, what does that mean? So I'm trying to explain the meanings behind the intricate symptoms that a patient has, which can cause a symptom to them. And the reason why we are using this for long COVID is because patients who have long COVID have a whole variety of different symptoms. For example, they'll have palpitations, they'll have fatigue, but the fatigue is not the same for every patient, it's different. So it's that subtle difference in what the patient is saying that makes a difference. Normally, as doctors, we are not trained to listen to those subtle differences in what a patient says. And that's what I'm teaching doctors to do, to listen to what those subtle differences are and to understand the pathways which are causing those subtle differences. What we are using to help these patients is we are using homeopathics, which are low dose medicines. Along with that, we are also using low dose cytokines to treat them. The advantage of using a homeopathic, and I've found this from personal experience, is these homeopathics are very specific. They work very specifically. So you have to ask the patient a whole bunch of questions to be able to understand this homeopathy works. But the problem with classical homeopathy is the doctor prescribing the medicine does not understand the pathway that is being affected by the drug. So what I've done is I've basically mapped these pathways out where we know exactly what that homeopathic is doing, on which pathways it is acting, and why that symptom that the patient is having is going to respond to this homeopathic drug. So you know exactly that this homeopathic drug is going to work on this patient. That's what I'm doing. I'm mapping these pathways out. We have our own rat lab where we do our own rat experiments. And by doing all these experiments, we come to know what these medications are doing. And that is what I'm teaching allopathic doctors. I'm teaching allopathic doctors homeopathic medicines in an allopathic form. And this is, I think, the crux of what precision medicine should be. Usually when you say that I want a personalized medicine approach to treat my problem, what you're basically saying as a patient is I want the doctor to understand my unique symptom that I have. I have a headache, but that headache is getting worse on cold exposure. What does that mean? So the doctor says, well, I don't know what that means. You just need to take your Panadol. But it actually means something. That little symptom that you're saying means something. And I'm teaching doctors and patients how to understand what the meaning of that symptom is. I've had patients who tell me that my headache is getting worse after I vomit. Why does the headache get better or worse after the person vomits? Why does a headache get worse when you've not eaten food that day? These are all the questions that I'm trying to answer for doctors. Okay, and I'm also trying to answer this for my patients as well. So this is what precision medicine is actually about. It's not about getting random tests done and saying, oh, you have some heavy metals in your body, which may be causing your headache. Those heavy metals may simply be there in your body. You don't know that they're associated with a headache. Or you may say, oh, your blood test, one random blood test shows that you're allergic to gluten. The gluten allergy may not be connected to the headache whatsoever. It's just a random finding in a blood test. So, random testing is not the answer for what precision medicine is. It's the understanding of the symptoms and understanding what is the pathway that is causing the symptoms. So, I hope I have explained this in the best way that I can. It's just understanding pathways which are unique, causing you a particular problem or a disease.
Really well put. And I think that's why I feel really drawn to your work, because in my experience as a medical doctor, I had tried to look for solutions outside of the box. So I studied craniosacral therapy. I learned to listen to the body. I studied health coaching, nutrition coaching. I learned to listen to what food does to the body. And yet there were still limitations, because that it didn't fully explain all that I was experiencing. So now we've been training doctors, right?
Yes.
Now this webinar I know is for the lay people, and I'm going to try my best as a co-host and an audience here, live audience here, to help you with this process. But I'm kind of curious, like, if you're training the doctors, why is it that you're doing this webinar series for the lay public?
That's a good question again. So, the reason why I'm doing this is to help patients understand that their symptoms are unique. Now, the doctors that I'm training are slowly starting to understand the uniqueness of the patient's symptoms, but sometimes patients don't understand that their symptoms are unique. We have one doctor in a group who was asking a patient certain questions about her symptoms of her headache, and the patient got angry at the doctor, saying, why are you asking me all these questions? Just treat my headache. So the doctor told her, I need to understand what's going on with your headache. And then we came to know that her headache used to get worse after she used to eat sugary foods. Now, the headache used to get better after she would eat carbs. The reason was that she had insulin resistance. So her brain was not able to absorb the glucose. And that's why she was having chronic headaches, and she was pre-diabetic. So by treating her pre-diabetic state, by giving her NOx2 blockers, by giving her medicines that improve her leptin resistance, those headaches went away. Otherwise she was very happy taking the paracetamol every day, 2 times a day, 3 times a day, getting testing done for heart problems and all these other issues. She completely forgot that she was getting better after eating carbs. So I'm hoping that with this webinar series, the patients themselves understand that, hey, my symptoms mean something. Let me think, what makes my symptom better or worse? There's always going to be something, in the back of your mind that knows this symptom gets better or worse when I do something here or I do something there. If you have joint pain, you may notice that sometimes my arthritic pains get worse after eating sour foods. Why does it happen? You go to a doctor and you tell him, hey, you know what, my joint pains are getting worse on sour food, and the doctors be like, okay, I don't really want to think about this.
So
I'm just going to give
they'll
my
be asking,
patient the methotrexate.
so what, right? They don't really it doesn't set off anything in their mind. It's not
Exactly.
something that triggers anything.
Exactly.
Yeah. So I mean, I hear that in a way this is a self-help webinar.
It is. It's
This
a
is
self-help one. And I also hope
Yes.
that the people who are suffering from long COVID, when they listen to this, are able to, in fact, treat themselves, or help themselves out with the majority of the issues. And if they can't understand a few things, or they are confused about a few things which are spoken about, they can always go back, watch the video, or they can contact us for further help, and yeah, we'll guide them.
Sounds good. So,
And
yeah.
Dr. Day, I have to say one more thing, that most of the innovations in therapy have actually come from patients. So patients are the ones who research stuff and go to the doctor and tell the doctor that, hey, look, I found this out. And then the doctor has to actually understand what the patient is teaching him. So in most chronic diseases are actually helped by patients. There are cases in autism where parents with autistic kids have actually found out pathways which have helped their kids out, and then they go about teaching doctors about it. So it is actually a patient-driven movement in any chronic disease. The doctors are the last people to learn about a solution for a problem, because they don't have the problem themselves, so they're not thinking about it 24 hours in a day. The
Absolutely.
person suffering from it, he's thinking about it 24 hours in a day. He's like, I'm going to
Exactly.
fix this.
Exactly. Spot on.
Yeah.
So, so here we are.
Yeah, here we are.
And let's get cracking with the long COVID. So
Sure.
this is the it's a good place to end the first video. So
Yeah.
this webinar series is for you listening to us now. There is hope, there are solutions, and there are us, a team of doctors. In a way, we are relearning medicine. We are relearning this brand of medicine that we want to name, as this channel is called, Low Dose Precision Medicine. So subscribe below and stay tuned for the next videos.
Thanks a lot, Dr. Day.
You're
Thanks for
welcome.
hosting me. Thank you.